Welcome, everyone. Thank you so much for joining us today for the Caring for the Caregiver webinar in honor of Parkinson's Awareness Month, presented by the Executive Office of Aging and Independence and the Mass Tech Collaborative. Today's topic is building a Parkinson's village, care team, community supports, and long-term planning. My name's Liz Gallagher, and I'm the Strategy and Analytics Manager at the Executive Office of Aging and Independence, and I'm thrilled to welcome you to this important discussion today. So, this session is designed for people living with Parkinson's, family, care partners, and aging network professionals. Together, we'll explore practical ways to strengthen the Parkinson's Village by building the right care team, connecting with community-based supports, and planning ahead with confidence. And we are pleased to welcome three wonderful speakers today. We have Cathi Thomas, who is a clinical nurse specialist in neuroscience and an assistant professor of neurology at the Boston University Medical Campus, where she also serves as the program director of the Parkinson's Disease and Movement Disorder Center. In addition, Cathi is also the American Parkinson's Disease Association Massachusetts chapter information and referral coordinator. So, Cathi will be providing us with an overview of Parkinson's disease and the Parkinson's caregiving experience and share guidance on navigating care, building a strong Parkinson's care team, and connecting to services and resources. Anne Muskopf is an occupational therapist by training and serves as the director of the Charlotte and Richard Okonow Parkinson's Family Support Program at Jewish Family and Children's Services in Waltham. And that's a program that specializes in, or they have a program there that specializes in arts-based therapeutic programs and family-centered support for the Parkinson's community, and will speak to the value of community-based supports for people living with Parkinson's and their care partners, and how these programs can complement medical care by promoting day-to-day functioning, emotional well-being, and connection. And then we also have Virgil Stucker, who is a care partner to his wife Liz, who's been living with Parkinson's disease for 12 years now. And he also serves as the coordinator of the Berkshire Parkinson's Support Group, which has 99 members, 53 living with Parkinson's, and 46 care partners. And Virgil will introduce the long-term planning guide that his group has been developing for their members and other individuals living with Parkinson's and their families, and we'll share how this tool can help families look ahead, set realistic goals, and organize their medical, legal, financial, and emotional supports to help avoid crises. So before we begin, a quick note for those attending. Um, Please feel free to submit your questions in the Q&A box or the chat. You can also submit questions anonymously if you'd like, but please do not put any identifying information in your questions, and there will be dedicated time at the end of the session to address your questions. Live transcription is also enabled for this webinar, and you can access the live captions by clicking the CC or live transcript button in your Zoom toolbar. So now I'm going to hand it off to Cathi for her presentation.
Thank you so much, Elizabeth. I really am happy to participate in this program today, and would like to thank you and your colleagues for putting this program together and really recognizing the important needs of not only the person living with Parkinson's, but their family care partners. So today I want to briefly describe what Parkinson's disease is, the importance of putting together a knowledgeable and supportive health team, highlighting some of the potential strains associated with being a care partner, and then talk about discuss some research-based interventions that have helped reduce strain. And before I start with this first slide, These are really just some thoughts that I have learned in my experience of working with individuals who have a diagnosis of Parkinson's, their care partners, and also the healthcare team. And the first really is to share with you that there has been tremendous progress in understanding and treating Parkinson's disease. During the past decade, new treatments have evolved. We have a better understanding of other treatments outside of medicines, such as the role of physical therapist, occupational therapist. And we also know that there's been progress in surgery, and most importantly, significant progress in diagnosing people earlier than we previously did. So that's very, very exciting. Certainly a lot more work to be done, but progress is being made. The second thought is that Parkinson's is really highly individualized from person to person. So not all that is discussed may be relevant to you. We know that PD impacts not only the person diagnosed, but family, social networks, and the community at large. And what's really important is that the healthcare team has to be very familiar with signs and symptoms and treatment strategies in Parkinson's. And we know there's strong evidence that managing Parkinson's requires a team approach. Next slide. So what is Parkinson's disease? It's a neurological condition, health condition, that affects a person's ability to perform common daily activities. It causes motor symptoms or problems with moving, as well as non-motor symptoms, which include sleep disturbance, constipation, anxiety, depression, fatigue, among others. And we know that the common motor symptoms, which are muscle rigidity, slowness of movement, or what we call bradykinesia, and tremor, are due to the lack of a brain chemical called dopamine. Next slide. So in the US, approximately 1 million individuals live with a diagnosis of Parkinson's, and 60,000 plus new diagnoses occur each year. And here in Massachusetts, we have about 21,000 people living with Parkinson's. Now, the average age of onset is approximately 60 years old. So if we look at our current demographics, we know that we have a large population of people between 55 and beyond, so that we can expect to see more cases, and we are certainly seeing this in practice. And it's really important to know that about 10% of people with a diagnosis of Parkinson's have what we call young onset Parkinson's. So they develop symptoms before the age of 50. And men are about 50% more likely to have a diagnosis than women. Next slide. So developing a care team, I think, is so important in how a person navigates this diagnosis. And as I mentioned, it's not just the individual, but certainly the family members, the healthcare team, et cetera. What's very, very important is that a diagnosis is made, hopefully earlier, particularly as we make progress and hopefully developing treatments that may protect or provide neuroprotection. So we rely on a specialist, a movement disorder specialist, who is a neurologist who has a extra training in caring for people with movement disorders such as Parkinson's. Here in Massachusetts, we probably have about 45 to 50 of these movement specialists. And as I mentioned, as the increase in numbers of individuals with this disorder, we know that that is not enough, but we're very, very unfortunate in this region to have this number, because across the US, there are areas that a person does not actually have a movement disorder specialist, and even some areas that neurologists are not available. So I think here we have a great group of people, and we do, through the APDA, keep a list of these specialists so that people can reach out for referral. Another important part of the healthcare team or a care team is providing psychosocial support. I mentioned that people may exhibit problems with anxiety or depression, or may need some assistance with planning their days. So many people will be referred to a psychiatrist, a psychologist, or a social worker to help manage these problems. The rehabilitation team is incredibly important. This is, in fact, a movement disorder that impacts not only large movements, but fine motor movements, and can impact a person's ability to speak. So PTs, OTs, and speech therapists are very much part of a person's healthcare team. And then people have to have really good care of their general health. So we want to be certain that people have a primary care physician or subspecialists such as nutritionists to keep people well. And in some cases, nurses will play a role in Parkinson care. And there are a number of different exercise and wellness programs that there's great evidence to show that they help with Parkinson's disease, including Tai Chi, yoga, boxing, etc. Thank you. Next slide. So I do want to just mention some of the difficulties care partners may experience by delivering care. We know that over time, Parkinson's does progress, and oftentimes care partners will also have difficulty right at diagnosis, a whole sense of worry and concern. We know that Parkinson's may impact people's motor, so care partners oftentimes have physical demands, maybe helping with transfers, maybe waking up during the night if their loved one has sleep problems. Parkinson's can impact a person's financial status, maybe if the person stopped working earlier. There can also be significant emotional strain, and a care partner can be prone to having depression or other mood problems, and certainly social isolation. Okay, the next slide. Okay, so what do we know? There's strong evidence that right at diagnosis, that the care partner or the family member is very involved in care. We always try to maintain a person-centered approach. So there may be situations that the person with Parkinson's does not want that, or the care partner is not so involved. But we encourage that a care partner participate in the healthcare setting, because I know that we can learn a lot from both points of view. We know that information, just as with the person with Parkinson's, should be highly individualized. We always try to balance optimism and hope, but also with the reality of anticipated progression. And one of the most important things for the person and care partner is that they understand the disease process, how to manage the process. There's a lot of things to learn. Parkinson's is complex, lots of therapies, coordination of all of these services I described, etc. And we try to employ self-management strategies to improve a person's communication skills, how they report information to the healthcare team, and really highlight the importance of taking care of oneself. Next slide. Okay, so psychosocial support I previously mentioned, very, very important. A person with Parkinson's as well as their care partner oftentimes may benefit from a referral to a mental health provider as licensed social worker or psychologist, or referral to a self-help or care partner support group, which Anne will discuss in a moment. And then the final slide. I just wanted to highlight some of the information that we have at our APDA Information Referral Center, including a helpline. And I did want to highlight one program that may be helpful for people. APDA supports a National Rehabilitation Resource Center in Boston, where a person can contact the center and be kind of referred, or maybe not referred, but they will share information on who is providing these services close to home. So people do utilize this from across the country. So it's a great resource. And with that, I would like to ask Anne to join. Thank you so much.
Thank you, Cathi and Liz. Um, so I'm here to talk about community supports and just a note about Jewish Family and Children's Service. We are a nonprofit organization located in Waltham, and we service the greater Boston area and beyond. We do serve all faiths and backgrounds, and we have a vast network of community partners and connections to find the right resources for you. So next slide, please. If I leave you with only one thing, I hope it's this, that community supports are a critical link between medical care and daily life and living well with Parkinson's. We're very fortunate to have a wealth of medical resources in Massachusetts, and they are truly an important part of medical care for Parkinson's, but they are limited. So, having worked myself in a clinical setting as well as a community setting as an occupational therapist, I really see the benefits of this comprehensive and holistic care in supporting quality of life with Parkinson's. Next slide, please. So, Cathi mentioned some aspects of Parkinson's disease, and I just wanted to highlight a few areas that that are affected by Parkinson's, including mobility, speech, and mental health. Even though it is different for everyone, it's not hard to imagine how these things can be isolating. For example, with mobility, that stiffness or freezing of gait can make it more difficult to leave the home. And if an assistive device is needed, then heavy doors or uneven sidewalks or bathrooms can be a challenge. With the lower voice or quiet voice of Parkinson's, it can lead to decreased self-advocacy and less socialization. And the mental health challenges for both care partners and people with Parkinson's, including anxiety, depression, and apathy, can result in reduced engagement and overall self-care. And we know that isolation is an epidemic for many Americans. Next slide, please. But I'm really here to offer encouragement and hope that there are many wonderful programs out there to address these in a safe, understanding, and caring space. There are ways to continue with therapy beyond the clinic and reap the many benefits of being in a community. And I'll speak more to these in a moment. So next slide, please. So many of us, whether we have Parkinson's or not, find it difficult to stay motivated to do that regular exercise that we know we need. So group classes really have the benefit of accountability and instruction for those doing them. So I just wanted to highlight a few that are available specifically for Parkinson's. The first is Dance for Parkinson's. This is something JFNCS offers, and it addresses things like coordination, balance, social bonding, and even cognition, according to the research. As well, many people are familiar with the boxing programs, but there's also yoga and Tai Chi, cycling or pedaling, ping pong, pole walking, and other sort of strength, cardio, and balance classes. Even more recently, I've seen rock climbing, golf, and crew or rowing for Parkinson's. The question I get a lot about exercise is really what is the best exercise for Parkinson's? So I'll just address that briefly. While it's of course important to think about the guidelines of 150 minutes at least a week of exercise and rigorous exercise, also looking at strength, flexibility, and cardiovascular fitness so that a variety of activities is recommended. Ultimately, the one that you're doing is the best one because you want to be able to find joy in what you're doing, and that's what these community programs can offer. Next slide, please. To address some of the speech challenges that often come with Parkinson's, certainly there are education groups with a variety of topics and speakers to help engage in conversation. There are support groups. Again, I'll go into that in a moment. Um, Speak Out is a particular program, just one of a few that addresses speech therapy issues with Parkinson's. And they host a post therapeutic intervention group called the Loud Crowd, which is free and it engages in conversation and continuing that working those skills. And the last one is a chorus. So studies show that group singing creates social bonds and reduces stress, as well as helping strengthen the muscles involved with voice, breathing, and swallowing. And this is something that JFNCS offers as well. Next slide, please. And then coming up to mental health supports. So first, I just wanted to mention the caveat that these are not a substitute for individualized psychotherapy. If you're looking to find a therapist or more support, JFNCS offers a free support group connector called Mental Health Connect. And they'll listen, they'll take your insurance information if that applies, and help you find the right person. So the contact information is there. For people living with Parkinson's, there's a lot of different ways to find a group. Certainly, there's regional groups, such as Virgil will be talking about after me. Sometimes senior living communities organically have a group that often tends to be more peer-led and social in nature. There are groups for young onset, as Cathi mentioned, those below, well, who are diagnosed around 50 years old or younger. There are support groups, especially for women. For those who are seeking a surgical treatment called deep brain stimulation or DBS. There are support groups for Parkinsonisms or related diseases such as Lewy body dementia or PSP, which is progressive supranuclear palsy. And then also therapeutic arts. I added this because research again shows that these can be safe, helpful spaces when a creative activity is done in a group, that can create social bonds. And we know people who sometimes will just say, I'm not a support group person, but they engage in therapeutic arts. We have one member in our chorus who says, support groups are not for me, but being here with this community, people who understand me, this is therapeutic for me. We also offer support groups for family members. As Cathi mentioned, it is a disease that affects the whole family. So we offer care partner support groups as well as the APDA support group offerings and others around the community, and one for adult children. And really, support groups are meant to be safe places to ask questions, to talk about challenges to those who have a similar understanding, and really just not to feel alone. So they're really an important part. Next slide, please. So next question, how to find community programs in addition to the old Google search. I'd suggest trying to make a connection with someone personally. So the APDA, as Cathi mentioned, has a wonderful resource, phone line and website for information and referral. As well, JFNCS has one, and we have something called Senior Direct, which is a free senior advice line. We'll include this in the follow-up email. The local council on agings or senior centers. Again, this will be in the follow-up email around mass options, but they're great resources. Movement disorder clinics and social workers that work in them may have connections as well to help refer to your local community. And also just even asking around. Sometimes word of mouth is best. If you're striking up a conversation in the waiting room of the doctor's office, the movement disorder specialist, you might find a great resource that way. Next slide, please. So my final tips are just to always call first and ask questions, make sure the group is still running. Sometimes these change. But think about how would you describe the group? Can the activities be adapted, whether they're seated or standing, especially for these exercise groups? And then I think it's important to ask if the facilitator is specially trained in Parkinson's, if they have that understanding of where things are coming from and what might be a non-motor symptom that's related that someone who's not familiar may not recognize. Of course, what do I need to bring? Is there an online option? Many of these groups are available online or in person. And are there fees? Can you try it for free? Do you provide financial aid? I also encourage people to go with an open mind and really to try things a few times before you decide. Learning new skills and trying new things, it's really good for neuroplasticity or making those new brain connections, but it really takes time. So try to keep an open mind, give it a few times before you decide. I also recommend going with a buddy. It could be a care partner, a neighbor, a friend, someone to encourage you and show up with you and show the solidarity. It helps to make it a routine. And make sure that you're caring for your mind, body, and spirit. It's so important that it's challenging, but also fulfilling and provides joy. That's really what this is all about, is providing joy. And last slide, please, Liz. So again, I just wanted to remind you that I think community supports are such a critical part of living well with Parkinson's because Parkinson's is a multi-system disease. We know that. And so treatment and care really should have a multi-pronged approach. So I just wanted to close with this quote from someone living with Parkinson's that I know that said, "There's nothing more important in this world than having a connection in a community." And with that, I'll pass things over to Virgil Stucker, who will share a long-term planning guide he's been developing with families in the Parkinson's community. Thank you.
Well, thank you, Anne. It's really an honor to participate in this webinar with Liz and Cathi and Anne. I'm Virgil Stucker, volunteer coordinator of the Western Massachusetts Berkshire Parkinson's Support Group. But more importantly, I'm the care partner for my soulmate, Liz, who was diagnosed with Parkinson's 12 years ago. Like many of you listening, I know that Parkinson's is not just a diagnosis for my wife, but it has become a central part of my daily life as well. It affects everything. It dictates our morning routines, drains our energy, plays with our emotions, shifts the traditional roles in our marriage, and it alters our plans for the future. At 73 and 74, we sort of thought we might become like Peace Corps elder volunteers traversing the world. We're at home. Our 4 children and 9 grandchildren, however, are traversing the world over 6 different countries in which they live, and thank goodness for Zoom so that we can stay in contact. Consider for a moment the dilemma that we as care partners sometimes are in. Unlike being the care partner for a spouse with a shorter term or more predictable disease, the Parkinson's care partner is on a marathon journey with decades of dealing with symptoms that they progressively worsen, often in completely unpredictable stages. And yes, we work to try and slow the process. As care partners, we live with a pretty constant tension. On the one hand, we pour our energy into the present, helping our partner with Parkinson's to have a good day and hopefully a better tomorrow and even the next day. On the other hand, part of the dilemma is we try to look beyond to our uncertain future. But, if we're honest with ourselves, we're too frequently slow in developing longer-term plans. It can be understandable. Long-term planning is emotionally taxing, and we may already be feeling somewhat overwhelmed by the day-to-day responsibilities that we have. However, we must, and I underline must, recognize that our lack of preparation can set us up for crises that could have been avoided had we planned better. Fortunately, Liz and I feel somewhat less overwhelmed today because we have developed long-term plans, have an excellent medical team, and share our lives with our 100-plus member Berkshire Parkinson's support group. That's both care partners as well as people with Parkinson's. Now, recently as a group, we decided to tackle a vital question. How can we make longer-term planning easier for families like ours? We created a long-term planning resource guide for our region of Western Massachusetts. And today we're going to unveil our website, which incorporates this guide as a set of practical tools. And while it is tailored for our region, we think it is actually useful for people across the Commonwealth. So here's our new website, berkshireparkinsonsupport.org. And this is our home page. If you bounce down to the bottom, you see we have a contact form. So if you wish to contact us, you can do so there. And up in the top, there are various pages that you can go to for planning. Let's go to this first one, Essential Hospital Planning. Essential. I think some of you know probably already that during hospital stays, hospital staff do not often comply with the strict time-sensitive medication regimen that's required for patients with Parkinson's. Now, this is a national problem. Symptoms can spiral as a result, extending lengths of stay, adding avoidable rehab, and frankly, sometimes causing irreversible harm. We're proud to say that as a group, we successfully negotiated with the Berkshire Health System's hospital leadership to arrive at specific protocols that assure that medication compliance for our loved ones when they're hospitalized is assured and accomplished. This page on our website can be shown to hospital staff during the admissions process as a helpful reminder. And I would encourage those who are listening who are in their own support groups to maybe use this page and try and negotiate with their healthcare systems to create better protocols so that medications can be reached on time. Next, I'm going to our resource directory. As we heard also, Cathi has an amazing set of resources to offer. These are some of the resources that are more regional for us. She was pointing out the importance of movement disorder neurologists. So in Berkshire County, we have no movement disorder neurologists. So our list goes from the west, Albany, south, the Hartford healthcare system, west to Worcester, and also Boston. So we have these resources here, and as you see, a whole array of resources on the website. And we hope with this directory that when a new problem arises, a care partner doesn't have to start from scratch, as frantically searching on Google for someone to help in sort of a moment of panic. So this directory is meant to be a trusted resource, can save some time, reduce stress, and help families act sooner to get the people that they need for support. I'd like to also take you to the planning worksheets on our website. So here we have a set of interactive planning worksheets. Now, a thing that I'd like to emphasize right away is, don't try and take the whole thing on all at once. It's good to sort of go step by step. What we have is a series of worksheets that are arranged with sort of checklists in mind. Let me show you what I'm talking about. I'm going to open up step 3 here. In this set of worksheets, we have organized a way to think about planning across 8 categories. Physical, medical well-being, that's one category. As you look at that, you look down the checklist and think, oh, I haven't thought of this, or I have thought of that. When do I need to do it? Next section helps you prioritize it. And then you can create short and long-term goals. So we've set this up for each of the categories: cognitive mental health, making sure your house is safe, looking at a category of assuring care partner health, looking at very long-term planning. So, and One thing that we added actually this morning, based on some questions that came from some of the attendees, is a checklist to help you understand when and how to seek extra home support. So, some rationale about when to do it, and then a checklist that you can go over and say, okay, do I need this help? Do I need that help? It's a long set of checklists, but if you go over it, then you can figure out what might be helpful for you personally. To also try and make it easier, the first two buttons on this sheet are downloadable sets of these worksheets, one in Word and another in Pages for those who are Mac users. And that way you can open it on your computer, type in, your own planning, print it out, and then come back to it, look at it again when you need to. So I'll stop the sharing for a moment and remind you that our website, which can be used, as you see, for people across the Commonwealth and beyond, we hope that you will use it, berkshireparkinsonsupport.org. I hope that as you look at it, it might help you answer at least three questions. What do I need to do now? What might I need to do next? And what could I put in place before we are actually in a crisis? That kind of planning can make a real tangible difference. It replaces paralyzing uncertainty with some readiness. And for care partners, readiness matters. It helps us feel less reactive, more grounded. It allows us to have some of those difficult conversations earlier when there's more time, less pressure, and more choice. Planning ahead is an act of profound care. And we can't plan for everything this disease will throw at us, nor should we try to. However, we can plan for the next step, the next two steps. And sometimes taking that one step is enough to turn fear into action. So thank you. I'll turn it back to Liz now, who will lead us through some questions.
Thank you so much, Cathi, Ann, and Virgil, for your amazing presentations. And I also have put the link to the Berkshire Parkinson's support.org in the chat. And I know we've covered a lot of information today and shared a lot of resources, but please don't feel like you have to absorb everything at once. We do post all of our Caring for the Caregiver webinars on our YouTube page that I'm going to put in the chat right now. And we will also be sending a email with the resources shared today during the webinar so you can review them afterwards. So don't feel like you have to write down all these websites in the moment right now. So now I'm going to lead us through the Q&A session. And we already have a question in the chat about whether somebody's asking that about the support groups because the Berkshire support group looks so great, but it looks like this attendee is in Eastern Mass. Cathi, I believe you have a resource for that.
Yeah, so support groups are always a work in progress. There are new groups, there are groups that have existed for a long time. We're really fortunate. We have, I believe, and you can correct me, at least 50 support groups across the region, but with 420 communities. But I first want to recognize Virgil in the work that he and his group, it's truly been a group effort, have done to expand and do what they need. But we do have a list of a lot of groups. We have groups that are led by lay persons, groups that are led by healthcare providers. So there's a wide range of them. One thing we are all very collaborative with each other, and I think that is so essential. We come together every other year for a nice conference, and so anyhow, feel free to reach out to any of us, and we will try to do the best to direct you to a group.
Great. And Virgil?
And I would also offer that the spreadsheet, the formats that we've created in our website if any other group wants to use that as a website for themselves, I mean, we're happy to give you that sort of basic framework and you can do it from there.
Great. And I was so encouraged by the questions in the chat. I wanted to briefly just touch on we're going to be addressing general topics rather than highly personal situations. And if you do need that individualized guidance about services and supports in Massachusetts, we do encourage you to reach out to Mass Options for direct assistance. And I will also put that in the chat in the follow-up resources, and that is a free service that refers older adults and people of any age living with disabilities to local supports and services. And if you're looking for that Parkinson's specific information and support, you can contact the APDA Information and Referral Center by phone or email. And one other state program I did want to highlight is the Family Caregiver Support Program, which connects family caregivers with a caregiver specialist who will provide information, tips, resources, and other support and help you create a customized care plan. So, with that, we also received a few questions in our registration survey. So, one of the questions we received was, what are practical ways that extended family members, especially those who might live far away, a couple hours away, states away, can try to provide some meaningful support to the primary care partner? So, if anyone has any tips for how those long distance family members can provide some support.
I can start and just say that, in the case of adult children, that is a common theme of our support group, and learning how to support them from afar and utilize, sibling support, neighbor support, things like that, do the research and to make visits more meaningful and productive is definitely a theme of that. So, encourage that. And one of the benefits of, having support online in this day and age is that even if something is hard to find in a particular community, many communities will open up to a larger geographic area and still have some supports and common themes.
Great, thank you.
And then also, I guess I would add in regards to that question, my wife and I have 4 children, and we try to make sure that they're aware of what's going on. That communication, I think, is important, so that way they understand. And if they understand also if we ask for help, what the form of it might be. And I'm really appreciative that our children occasionally get together to sort of discuss things with one another, plan with one another. And I see that our oldest son has joined us from the Canary Islands. So glad to see that they're in.
Fantastic.
Hello
And
to
thank you for joining us. And one of the other questions, Cathi, I know you have a medical background. Somebody's asking about how a patient would go about getting a referral for a nutritionist or mental health care. Would that be through their primary care physician?
Yes, it actually may be a combination. You may have to get the actual referral, but there are specialists within all of those disciplines. So not
Mm,
all physical therapists understand Parkinson's. So
mm,
I think it is a little bit of homework. So between your neurologist, your primary care, as well as these great resources that we have in the community. It's easier, not always easy, but easier to find the right care provider.
great, thank you. And somebody commented in the chat, for caregivers from afar, engaging a local aging life care manager can be very helpful. Just a tip that somebody posted in the chat. And another question that we had received in our registration survey, somebody is wondering for families that are looking further ahead later in the disease process later in the stages, what services or planning steps can help support someone beyond just hospice alone? So looking at those later stages.
I mean, one comment would be that we now, in many centers, have palliative care
Mm-hmm.
providers, and that can be through visiting nurse agencies in hospitals. And it's a really interesting area, different than hospice and end of life care. Palliative care, you kind of manage the ups and downs, which people with Parkinson's do experience. So I think strong palliative care programs can be helpful.
Yeah, that's great. Thank you. And another question that we had received in the chat, somebody was wondering about kind of the difference between Parkinson's disease, Parkinsonism, and Lewy body dementia, and kind of how these different buckets overlap or are connected.
Mhm. Yeah, so really, really good, important question. They are different health conditions, although Lewy body, that is actually the pathological marker in Parkinson's disease. If you have a Lewy body dementia, it just may be an expansion. So there is debate around these topics. Parkinsonisms, there are a number of reasons. It could be medication induced, meaning you took a medication that a person develops Parkinson's symptoms. It could be another neurodegenerative condition, um, such as progressive supranuclear palsy or multisystem atrophy. Those are rare conditions, but they do exist. So this comes back to the importance of having a movement disorder specialist
Mm,
trained in identifying that. And then also the newer ways to diagnose through skin biopsy and DAT scan. And I don't want to be too technical, but this is helping that, helping people better identify um, patients
yeah,
because treatments are different for sure.
thank you. And for those community-based supports and programs and support groups, I was wondering, Anne and Virgil, do you have any people that come to your programs that say, I wasn't sure about coming, I put off coming for so long, and now that I'm here, I wish I came sooner. Do you have a lot of that?
All the time.
Yeah.
I think it can be intimidating, and that's why it's important to, make that call first and make sure that, people understand that what goes on and try to make a good fit. But there's always such a sigh of relief in this just acceptance of knowing that, what you're thinking or what you're saying isn't anything anyone else has, not thought of before. So I think one of the best things when we have a new member join our groups is just the head nods throughout the whole Zoom of yes. And so that is a very common thing, and people are welcome at any stage in the disease.
Yeah, what I find with our members, because again, we're in Berkshire County, which is pretty rural. By
Yeah.
my estimates, we probably have about 450 people in the county with Parkinson's at least.
Yeah.
So we have, I think, 55 members in our group that have Parkinson's, and the others are care partners. And I mean, it's continuing to grow. And the theme often is, wow, I was feeling so alone. But now that I'm here and I see all these other people and we're supporting one another, that, they're glad that they've arrived. And fortunately, it seems like we're getting more and more new people, newly diagnosed. So
Mm,
I'm glad of that too, so that they can get some information and connections right up front because, often they don't really know where to go to get the support they need.
definitely. And of course, I'm sure once they enter the group, people can get talking about, oh, I see this doctor, make different connections with those sorts of resources as well.
Yeah.
And I'm curious, Virgil, for your support groups, for those wondering, what is kind of the style of the support group or the format, or is it more free form? What do those look like?
Well, it's actually once a month in person. Our local library in Monterey hosts it, which is really
Mm-hmm.
nice. And the first hour is an educational hour. For
Oh.
example, recently Cathi came to do another educational hour with us. She was actually instrumental in getting the group launched years ago, and so she comes every once in a while to check in, and always a great infuser of energy. So it's education the first hour, and it's also the second hour we break into two groups for care partners and another group for people with Parkinson's, each professionally facilitated, and that creates another opportunity for sharing. Once a year, we do an annual sort of celebration together, having a nice meal together, and talking about things that aren't just about Parkinson's and about the
Yeah.
joy that we try and bring into our lives. It's also a group that has sort of an existence online, a lot of monthly group emails in between meetings and sometimes Zoom meetings. And our monthly meeting now is also on Zoom because last meeting, I think we had 53 people show up. So, fortunately, not all 100 people show up at one time. So on Zoom, more people can attend. Um,
Yeah.
yeah. So,
That
yeah.
sounds fantastic. And I'm sure I can tell a lot of people in the chat, they're excited to get connected with one locally because of what you have built. So hopefully we'll be getting people connected to their local support groups as well. And that is all the questions that we have today. But before I wrap up, I just want to once again thank you, Cathi and Virgil, and all of you for attending today, for all of your valuable insights and your engagement in today's webinar. And as you exit the Zoom, please take a moment to complete the post-webinar survey. Your feedback is greatly appreciated and helps us to improve future sessions. So thank you all and have a great rest of your day.
Thank
So
you.
Thanks. Bye.